everybody. This is the beginning of your new lecture series. It's medical assisting skills. So I will do what I normally do. I'll lecture via video and you take notes. Pause is necessary. You will have a vocabulary quiz this week on Friday, and I do understand you will not have rotations on Tuesday or Thursday due to testing. So again, these are your notes for your new lecture series, and you will have a test not this week, probably about a week and a half, depending on how long it takes you all to get through this. I will make sure I take detailed notes because you never know when I decide to email Miss Dorsey a pop quiz or when she decides to give you one. So make sure you have plenty of paper. Do not take pictures of my PowerPoint. I expect you to write notes because that may be a grade as well. I may be going a little fast, so you have to pause. I don't know what my child is doing. He's in and out of sleep, so I may have to stop and leave, but I'll get through this as fast as I can. If you have any questions, as always, email me and I will get back to you as soon as possible. All right, medical assistant skills. First thing that you're going to go over or that you would know is height and weight. Measurements are taken in many, if not all, healthcare fields. It is considered a vital sign. It's used to determine if the patient is over or underweight. Either of these conditions, being that it's under or overweight, can indicate disease. Measurements are usually routinely done when a patient is admitted to a hospital, a long-term care facility, and it is also a part of the general physical examination in a physician's office. So when you go for a physical, a checkup, you always have your height and weight checked. In my office, we check height and weight at the beginning of each new patient exam, and we also check height and weight at any re-exam. Infants and toddlers are monitored frequently because growth is rapid. Infants are checked every 2 months, and the measurements are recorded on a National Center for Health Statistics growth graph. Hint, hint, I would put a star by that bullet. The graph information allows the doctor to check the child's growth and compare it to the average percentiles of other children the same age. Abnormal growth patterns may indicate nutritional deficiencies or genetic diseases. If you look to the right of the screen, this is what the chart looks like. And at each doctor visit, the weight, length, and head circumference is taken for the child. Patients with cancer are weighed frequently for weight loss, edema from swelling due to heart or kidney disease. Weight is taken daily. meaning that these individuals have excess fluid that has normally built up around their legs and feet, and their weight can be affected because it's primarily fluid. When taking daily weights, be sure to use the same scale every day. Make sure the scale is balanced. Weigh the patient each time, each day. Make sure the patient is wearing the same amount of clothes each day. So if you have them wear their normal attire, jeans and a t-shirt, they need to have on jeans and a t-shirt. If all they have on is a hospital gown and their underwear, then that's what they need to wear. But when you're taking daily weights, in order to stay accurate and consistent, the patient needs to wear the same amount of clothing each day. A wheelchair scale is convenient for those who may not be able to stand. When I gave you a tour of Park Manor in the restrooms or the shower rooms, I should say, there is a wheelchair scale. If you don't remember, go look at it. A beam balance scale has weight bars. There's one in the back of the classroom. The bottom weight is 50-pound increments and the top weight is 1/4 pound increments. Weight. Weight is recorded as pounds and ounces or as kilograms. Kilograms is generally used in other countries such as Mexico and Canada. We still use pounds. In order to convert a kilogram to a pound, or a kilogram equals 2.2 pounds. So in order to convert that, you would take pounds divided by 2.2 in order to get kilograms. Or if you had to convert pounds, if you had to convert kilograms to pounds, it's kilograms times 2.2, which will give you the poundage of an individual. Yes, this is important because if you have someone come from another country and their medical records are forwarded to you, you will have to convert this into pounds. The doctor that's referring to you will not do that for you. Height. Generally in a doctor's office, you're measuring inches. So in order to get the footage, you convert inches to feet by dividing by 12. Example, 62 inches divided by 12 gives you 5.166, which would then make that individual 5'2". Positioning a patient. A wide variety of positions are used for different procedures and examinations. Horizontal recumbent is also referred to as supine. The patient is face up. It is used for examination of the front or anterior part of the body. Prone. This is when the patient is face down. It is used for treatment of the back or spine. Or the posterior aspect of the body, such as legs, buttocks region. Sam's left lateral position. It is used for rectal and sigmoidoscopic examinations. enemas, rectal temperatures, and treatments. So you may not know what a sigmoscopic examination is. Hold that thought, and I will show you one. Alright, so if you've heard your parents or grandparents say that they're going for a colonoscopy, they're using what they're having done is a sigmoscope, a camera with a light, irrigation for water, camera, and the instrument channel, meaning if they found a polyp or abnormal growth, they can cut it, the doctor can cut it out or cut it away, remove it, and they go in from the rectum, up the colon, and examines the colon. Okay. Let me see. And this is what they're looking for. That one isn't good. I need a better picture. Here we go. They're looking for polyps, abnormal growths within the colon, and the instrument that you see or that I showed you in the prior picture will be able to remove those polyps. Once removed, the polyps will be tested to see if it's cancerous, and if so, further treatment would be recommended. Okay. So the knee chest position is used for rectal examinations, usually sigmoscopic examinations, which I just showed you an example of. Fowler's position is used to facilitate breathing, relieve distress, encourage drainage, and examine the head, neck, and chest. You must know that there are three positions of Fowler's. Knees elevated is the most common denominator in all positions. The first position is general Fowler's. It's 45 to 60 degrees. Semi-Fowler's is 30 degrees. And high Fowler's is greater than 80 degrees. Lithotomy position is used for vaginal examinations, Pap tests, urinary catheterization, cystoscopic examinations, and surgery of the pelvic area. I'll go back to this PowerPoint so you can continue to write, but I will show you examples of a urinary catheterization or urinary catheter. If you've never had surgery and you have not had to have one, this is not fun to get, and a cystoscopic examination as well. Uh-oh. Okay. So here is the catheterization. A tube is placed up the urethra where urine flows into the bladder. Because you may be on bed rest and you're not able to get up after a procedure, a catheter is inserted into your bladder to drain it. And it's probably more painful for a male because you have a longer urethra than a female. And here's another picture. This is just on a male, and it shows you how the bladder is drained into the catheter, out into a bag. And a cystoscopy exam is where the doctor may have to examine the bladder for reasons including excessive bleeding while urinating, incontinence, alright, so you can finish writing that one down. Dorsal recumbent position is similar to lithotomy position, but the patient is in bed or on a table without stirrups. Trendelenburg. It increases circulation of blood to the head and brain. It can be used for circulatory shock. It can also be used for pregnancy in order to keep the cervix closed. With Trendelenburg, the entire bed or table is elevated at the feet. The patient lies in horizontal recumbent position with the head lower than the feet. There is an example with a YouTube video, and I will ask that it be played now. I don't want to play it during this segment because you may not be able to hear it. Jackknife is also known as the proctology position. It is used mainly for rectal surgeries, examinations, back surgery, or treatments. Screening for vision problems. Vision screening test is given during a physical exam or to detect eye disease. A Snellen chart is used to detect distance vision. For children, if you see to the right, they're able to identify their animals. There are also Snellen charts for children that help them identify their shapes. And this is how it's determined that if small children need glasses. Excuse me. A person that has normal vision should be able to see characters that are 20 millimeters high. The top number represents the distance the patient is from the chart, and the bottom number represents the height of the characters that the patient can read at that distance. Generally, on a Snellen chart, there are fractions on the side. And what that means is the top number represents the distance the patient is from the chart, which will be 20 feet. And then the bottom represents the height of the characters that the patient can read at that distance. Let's see if I can find a better picture. A bigger picture so you can see the. Here we go. So here, it's always going to be 20 because it's 20 feet away. And then this is the height of the letter in which you can see. Line 8 on a Snellen eye chart is 20/20 vision. Also, when screening for vision, glasses need to be removed. With vision, there are some abbreviations that you need to be familiar with. OD is abbreviation for oculus dexter or right eye. OS is abbreviation for oculus sinister or left eye. OU is abbreviation for oculus urticae or each eye. And here are some vocabulary words that are associated with vision. Myopia is nearsightedness, which is a defect in the distant vision. Hyperopia is farsightedness, defect in close vision. Ophthalmoscope is an instrument for checking the eye. A tonometer is an instrument to measure intraocular tension, pressure. Increased pressure often indicates glaucoma. Glaucoma is a group of diseases that damage the eye's optic nerve and can result in vision loss and blindness. However, with early detection and treatment, you can often protect your eyes against serious vision loss. And how do we dilate? Why do we have our eyes dilated? You watch this during the video for vocabulary. And so if you like to look at that video again in regards to eyes dilation, feel free to do so. Okay. Well, that concludes this lecture series for medical assisting. I know I probably went a little fast, but you have the power to pause. Again, if you have any questions, please email me. I'll get back to you as soon as I can. For me, it's nighttime or morning time, so y'all have a good day. I'm going to sleep.